Greetings, everyone. Welcome to the Independent Producers Organization live showcase. And today we have a very special guest, Veterans Crisis Line. And it's Joe Bertagnolli.
Bertagnolli, that's right.
Oh, I did pretty good.
You did.
Suicide Prevention Coordinator, Clinical Social Worker. Is there anything else you want to tell us in that area?
Yes, so I'm a clinical social worker, psychotherapist, and suicide prevention coordinator in our outpatient mental health program at the Portland VA. I've actually been in this particular role for 10 years now.
Oh, okay,
Yeah.
okay. You were telling me what happens when they call in on this line. Can you go through that again?
Absolutely. Yeah, so our 24-hour Veterans Crisis Hotline is the way that we have that access open for anyone who needs to get help anywhere in the United States, 24 hours a day, 365 days a year. Anyone who's in crisis, or even anyone that's just concerned.
You're talking not necessarily veterans.
Right, that's right. It can.
Oh,
it's
yes,
absolutely, certainly for our veterans, but actually anyone can call it. So if it's a veteran that you know and you care about, perhaps it's a neighbor, a friend, or a family member, anyone can call regarding the veteran. And of course, we encourage the vets themselves to call. And then once they call, there will be an automated answering right away that says, if you are a vet or you're calling regarding a vet, please press 1, and that will direct the call to be answered by one of our trained VA mental health responders within 30 seconds.
That thing where you said, what if it's someone else calling in for a veteran?
Yeah.
Is that?
Yeah.
What happens
So,
then?
for example, and that's actually somewhat common, and mostly it's the vets themselves that call, but it's pretty common almost every day. I would say we've had a person or two that has called, say, overnight the night before here in Oregon that isn't a vet. They're concerned about a vet.
Right.
What's happening then is the VA staffer that answers the phone will converse with that person, they'll assist them, and they'll ask if it's possible that we can speak with the veteran. So, for example, maybe it's a family member and they're concerned about the vet. Maybe the vet is in crisis in the home, for example. And then we'll try to see if we can speak with the veteran and do our best to help get them centered, get them stabilized, find out if they need to maybe come to the hospital.
Yeah.
If it's a vet
that.
that isn't there with the caller, then we will ask what the veteran's name is and if we have the contact information for that veteran, and we'll take that and then we'll reach out to the vet.
So, okay, so you're trying to make contact with them, really, is what you're doing. And to get them to come to the hospital?
Yeah, it all depends.
Talk to them then?
Yeah, the first thing that's going to happen with the mental health responder that's speaking with the veteran on the crisis hotline is they're mainly going to listen. They're mainly going to validate the person. They're going to help them understand that there is somebody who is trained, that cares, that is listening, and is going to do everything we can to help that vet get centered and to be able to weather that crisis moment that they're in as safely as possible. So they're going to let the vet take their time to talk and explain what's going on with them. They'll offer some suggestions to help the vet get grounded to get through that moment. And then ultimately, before they end the call, they will ask the veteran, do you feel safe? Will you be able to be safe for tonight, for example, say, until the local SPC, myself, the suicide prevention coordinator, or someone from my program team calls back tomorrow, calls back within 24 hours to check back in with you.
You do that?
I do. That was part of what I did today. It's part of what I'll be doing tomorrow.
Right.
And most of the time, the veteran will say, yes, thank you, this has been helpful, you bet, I'll await Joe's call tomorrow, etc. Once in a while, I would say, just off the top of my head, probably 10% of the time or less, a vet will say, thank you, but I still am in a lot of crisis. Perhaps I'm, intoxicated. Perhaps I have a loaded weapon with me. I don't feel especially safe. I can't make any promises. I'm going to be around tomorrow when Joe or one of the team is supposed to call me. And in that case, the responder will say, thank you for telling me. I want to make sure that you're going to be safe. Is there anybody there that can bring you to the hospital?
Okay.
Do you need me to send somebody to bring you to the hospital? And we'll make sure that vet that's in that acute, potentially dangerous crisis does get rescued.
they do need to at least come to the hospital.
If they're in an acute crisis where perhaps they are imminently suicidal, for example, absolutely, we're going to make sure that they get to the hospital one way or another.
Boy,
Yeah.
I hope in the end you say, I did some good today.
Yeah. You know, Richard, I've been in this job for 10 years, and I'll say, you know, a lot of my friends will say, gosh, Joe, you've been a suicide prevention specialist at the VA for 10 years. Like, how on earth do you do this job? And the reality is that I'm working with the folks who are getting help. You know, I am working with the people that, by and large, most of my day is hearing folks say, thank you, you know, you're right, this is hard work, but this is helpful, it helps me get better, I'm looking forward to the next thing. The folks actually that we're losing, you know, that heartbreaking number of 20 plus vets a day that we're losing to suicide, the vast majority of those are the veterans that are not getting any help. About approximately the official statistic is about 14. So approximately 3/4 of the vets we're actually losing are not even enrolled with the VA at all.
They're not in the system.
They're not even in the system.
Going to hear about, let's say, their foot needs work or something else. They're not getting any of that either.
They're not engaged in any kind of help at the VA, let alone mental health. And what that means is that veterans who are enrolled at the VA and veterans who are engaged in mental health care at the VA have a dramatically lower rate of suicide than the vets who aren't. Like I said, about 3/4 of those vets we're losing right now are the vets that we're not even serving because they're not even enrolled with us. And that's why it's crucially important as we go forward to deal with this problem, that we encourage every veteran that could potentially be at risk to make sure that they come and do get enrolled with the VA and do get that mental health care. And that applies actually not only to vets, but actually to all Americans. So any American that is engaged in mental health care is statistically less likely to ever die from suicide than someone who isn't. Most of the folks we're losing are folks who are not enrolled and not engaged in mental health care.
I think I might have mentioned to you that when they come back and having trouble adjusting and seeing what's there and adjusting to that. Is that still one of the
Yeah,
things?
you know, the mindset that a person is trained to have and the mindset that a person needs to have when they're in the service and perhaps, you know, even deployed into an operational theater is different than the mindset that we need to have in civilian life back in the United States, right? In a sense, PTSD can even help a person stay alive in an operational theater in some sort of a very dangerous zone, because all of those symptoms, that hypervigilance, that impulsive reactivity, etc., can actually help folks stay extra alert to be able to respond to crises without freezing. Those things can help folks stay alive when they're in those dangerous situations. But when someone comes home and perhaps the danger or the source of their distress, we can say, isn't, say, an insurgent in Afghanistan, it's actually something inside their own life. You know, perhaps it is now their PTSD, perhaps it's things that might be associated with that, like other mental health problems they're having. Maybe it's financial difficulty, divorce, who knows what it might be. That impulsive reactivity, all of those symptoms can actually exacerbate things and make things worse, and even potentially turn that person inward towards being self-destructive in a response to their own distress, in a way that's ironically a mirror opposite, really, of the way that it might be when the person is say, like you said, deployed overseas.
homelessness?
What's that?
Homelessness.
Yeah, homelessness.
Or just homeless.
Yeah, that's one of the biggest problems that we have worked on the last several years. It's been a top priority for the Department of Veterans Affairs to address, is ending veteran homelessness, as well alongside with ending veteran suicidality.
They try to do it. I don't know. I don't see too many examples of that kind of thing. They're being successful, but I know they are.
Yeah. Yeah, we actually have. We actually have done well. I'm not assigned specifically with our homeless veterans program. I
Okay.
do work alongside folks who do.
Wow.
I know that we've dramatically reduced the number of homeless veterans in the United States in the last several years, and we've done very well here in Oregon with reducing the number of homeless veterans. We have a special hotline that is actually for housing for homeless veterans or veterans that are potentially at risk for homelessness, and those folks can also access a VA housing social worker 24 hours a day. They can help make sure that that person gets connected to help. If the veteran calls our overall crisis hotline and housing and homelessness are their major issues, then we will refer them to that hotline and also to our specific veterans housing program. So that door is open, just as mental health is overall. That door for any veteran that's struggling with homelessness that would like to get housing, we're there for them. And that's, as I say, a top priority along with suicide prevention.
I assume there's always a problem with drugs and alcohol and something, but you can't stay on top of everything. I don't see how you can. But must be some problems like that also.
Yeah, the thing about drugs and alcohol is that, we will tend to turn to those when we're trying to cope with our suffering. Right? And, we might think, well, if we assuage the pain and the suffering with the drugs or the alcohol, that's actually going to help us get better, help us get through this, in a less painful way. The problem is that actually what they do is they essentially turn our rational thinking off, and they really exacerbate our emotional thinking. So if a person's actually struggling with sadness and depression, they can get extremely sad. If a person's struggling with anger, they could get extremely angry. And as I mentioned, it basically turns off that rational thinking and it exacerbates that emotional thinking. It makes it therefore virtually impossible to get centered in our thinking, which is what we really need to try to do, and to be able to get through the crisis in the wisest way and most effective way that we possibly can. Anyone who's therefore turning to drugs and alcohol in order to try to cope with their suffering and distress is actually at increased risk.
Is what?
They're at increased risk.
Right.
Yeah.
Oh, yes.
And we have specific substance abuse treatment programs at the VA as well, both inpatient and outpatient. Substance abuse treatment programs that are a part of our overall mental health, outpatient and inpatient mental health treatment. And that's something readily, along with suicide prevention and with homelessness, that a veteran who wishes to access those substance abuse treatment services can access them virtually immediately. That door, again, is open for veterans. If they would like to call the VA, for example, any given day and say, I'm struggling with substance abuse, I need some help, that open access is there, and we'll schedule them an appointment right away.
Yeah. So they might just have to look up the number, because this number isn't in front of everybody all the time. And
we sure work hard to try to get it to be. That's right. But it can be looked up, and if they call the number, the 1-800-273-8255, and then press 1 to connect to the 24-hour VA mental health responder, whatever it is. So if it is a substance abuse or a substance addiction crisis, for example, whether it's a suicidal crisis, maybe it's a housing crisis, whatever it is, we're going to help them right away. We'll immediately answer that phone within 30 seconds and attend to helping them.
Oh. What about the different conflicts? Do they have? I guess I always had the feeling that Vietnam just must have been terrible. Some of those guys had no one behind them. I read the other day where VFW in one place wouldn't let the veterans in because everybody was against them. And I couldn't believe I was reading it. But that was in the paper the other day. And I just the different conflicts.
Yeah, I know that's not the case anymore. I visit our VFWs quite a bit in American Legion halls and other organizations, fraternal organizations of veterans, etc. And they're probably mostly Vietnam vets at this point. thankfully, and they're very supportive of them. I understand that, yeah, at that time, especially in the years immediately following, that there were a lot of those issues. At this point, we've found that in terms of the risk for suicidality, that it's not specifically pertaining to when a veteran served or if they were in during a certain conflict or even in during, say, the Cold War times, et cetera. It's really that all veterans are at increased risk. It's statistically, as far as we can tell, just by virtue of being a vet, period, that we are at increased risk. Now, it's true that there can actually be, in individual cases, exacerbating circumstances where, say, for example, a person has served now, in Operation Enduring Freedom, in Afghanistan, and perhaps they were serving in Iraq before that, and they've had multiple deployments, for example. Maybe they've served, 5 or 6 or 7 or 8, which is virtually unheard of in American history. Even in Vietnam, by far, most veterans, most personnel at the time served 1 tour of duty in Vietnam, which, as we know, was way plenty. And now we're, seeing veterans that come home from the Middle East that have served several. And I know that that's an exacerbating risk factor in many people's cases because they've expressed that to me. And here in Oregon, we have the Oregon Army National Guard, which has been a core participant in both serving in Iraq and in Afghanistan. And those folks have been activated multiple times. And we serve those folks that have served in the Guard. If, say, they're deployed in Afghanistan and then they come home and they may struggle with some issues, then they can come to the Portland VA, for example, and we'll take care of them. Just as the same folks that have served in the regular branches in the Army, in the Air Force,
the National Guard?
The National Guard,
okay,
yeah.
So they're included too.
Absolutely. Yeah, any National Guardsman, so for example, as you're saying, that may have been activated and sent to Afghanistan, and maybe they've, found themselves struggling with issues now related to that service. When they come home, they're absolutely eligible for their services, just as if they had been in the regular Army or another regular branch. When they come home, they can come to the VA and we'll take care of them.
When you're talking about those tours, don't they take them if they want them? Don't they want to be there? Don't they want to do it and get paid, or send their wife money home or something like that?
You tell me. You're the one you're the one that was in the service. Yeah, I mean, it's it's absolutely, I think, a sign, you're right, of courage and a commitment to service, because like all the branches right now, and it has been since Vietnam, right? They're all volunteer. They're all volunteer. We have an all-volunteer military, and so because we have, therefore, a much smaller military than we did, say, during the draft times, that when we have these very long crises, like the one in Afghanistan now that's, going on 18 years, right? We're using these same folks over and over and over again that have volunteered, rather than, during the times of conscription, and there were far more folks serving, in the military. Like I said, they may have many fewer tours per each person, but we have a special circumstance of exacerbating risk factors right now that the veterans I work with talk about. And you're right, they definitely volunteered, and we can't say too much at all about how respectable that is, and what a great debt of gratitude we owe to them for that.
They volunteer. That's
right, and they I think take on that incredible burden of being in a special time in American history where we're depending on those volunteers in a way that I've never seen us ever before. Depend on volunteers throughout American history. It's a pretty unique set of circumstances that we have right now.
Well, that's the circumstances we're in. We still have the conflicts going on. What is it? Libya? All this stuff. ISIS.
Yeah.
And we just, the United States doesn't always know exactly where to turn. I don't think we can. I was thinking more of conversations you might have with some of these veterans, and how does some of, can you talk about how some of that might go, or?
Sure. Yeah. So, for example, if a veteran has, say, called our crisis line overnight, a lot of folks tend to call overnight or over the weekends. Sometimes during the day, but a lot of them, it seems like that distress will really well up a lot. Commonly, the crises will come up overnight or over the weekend. And so, as I mentioned, our 24-hour VA hotline responders will speak with them and help them immediately. And then they'll notify us, they'll ask the veteran, do you mind if we have one of your local suicide prevention coordinators, such as myself, call back the next day, check back in with you, see how you're doing, what specific things you may need. Then what will happen is my team and I will get that message, and then we'll call that veteran the next day. Right. So say a veteran's called overnight, and they've been helped by the crisis line, but they know that I'm going to call them again the next day. So I'll call perhaps in the mid to late morning, and I'll check back with the vet, and I'll say, hey, I'm calling in response to your call to our hotline last night. I wanted to check in with you today, see how you're doing today, and what we could do to be of help for you. Yeah. I start with that. And it's always going to be a situation where I'm going to listen more than I talk. Right. I'm going to make sure that I express to the veteran that I am paying attention to them, and I'm doing everything that I can to figure out the ways in which we can help. It's going to vary, Richard. So sometimes it might be a veteran who is already enrolled with the VA, maybe already engaged in mental health care, but they've had, say, a crisis came up that they didn't anticipate. Say a veteran has a service dog, right? Like perhaps they have a service animal, and there was a crisis with that service animal. Maybe the service animal got sick, and they didn't know it or got injured, right? And that vet is in crisis now. I'm going to listen, and I'm going to say, hey, let's make sure that your animal gets taken to the veterinarian. Which vet do you go to? Did you take her to the vet? Yeah. I'm going to work on whatever that specific issue is with that veteran. If they say, yeah, Joe, I'm really struggling with this gambling. I didn't think it was out of control, but now it's gotten worse and worse. I think I'm coping with my problems by escaping into gambling, and now I think I'm addicted. I don't know. I think I really need some help. Then I'll focus on that, and I'll say, hey, are you working with anybody regarding that? And if not, I'll say, there's definitely options for us. Let's look at them. Let's talk about Gambling Anonymous. Let's talk about the specific treatments that we have at the VA, for example, with gambling addiction, etc. It could be family problems. Maybe the vet needs a referral for family counseling or couples counseling. Right. It could be that the veteran needs a referral for the substance abuse treatment program, the housing program, the vocational counseling program, our chaplains. Everybody needs different things. But I will listen to find out what it is that the vet needs, and then I'll help them make sure that they get connected to the specific help it is that they need. And if it's a vet that's not enrolled yet with the VA, then I will say, hey, we start by getting you enrolled. We can get you enrolled right now. And I've even said to vets, hey, how soon can you be here? I'll meet you out in front of the VA, in front of the hospital. We'll walk up into the enrollment office, and I'll show you where it's at. Depending on the vet, or they'll say, yeah, I can come tomorrow, and I'll tell them what to bring, or they can call in, however they prefer to get enrolled. But I'll just troubleshoot whatever the situation is, and all the members on my program team are the same. There's a half a dozen of us that serve here in our catchment area, which is the northern half of Oregon, roughly including central Oregon, and then the 6 southwesternmost counties in Washington State. And then we have other SPCs that serve in the other parts of Oregon and Washington.
They need those discharge papers if they're gonna get into the system as a veteran. They need those. Right. But you still talk to other people.
Yeah, so if you need to get enrolled, then all you need is your ID, just your regular, Oregon State ID, for example, and your discharge papers, your DD-214 form. If you don't have your DD-214 form, for some reason it's been lost or you just don't have it, that's not a problem. We can help you get a new one. Yeah. And they can actually still just come on into the enrollment office, just bring in their ID and say, I'm not sure where my DD-214 went, but we'll help order a new one and get them enrolled. But if they have it, that would be the only other thing that they need. And then, what was the second part of your question?
I've always saved him.
Yeah, very good. Right on.
That's right. Well,
Oh, and you said regarding other folks that can access us that aren't veterans, right?
Yeah.
So that is true. Yeah, anyone that is concerned about a vet can call in and let us know that they're worried. To the point, I remember once a few years ago, there was a fellow that called in and he said, there's a neighbor of mine up the street. I always see him and say hi to him. Last night when I was walking my dog, I think I saw him up on a roof. I think he might have had a gun with him. He seemed like he was in a mental health crisis. I'm pretty sure he's a veteran. I'm not entirely sure, but this is his name. And sure enough, we checked it out and pinned it down, and we found out that was a vet, and he was in a severe mental health crisis.
Oh.
We were able to figure it out and be able to get to that vet and serve him and get him into the hospital and help save his life and get him stabilized, because a man down the street who was an acquaintance of his knew that the man was in crisis and was pretty sure that he was a veteran. So, that's an extreme example. But like I said, it can be anyone that is concerned about a vet can call in, and we'll address it just the same.
Yeah, no, that's right. That's right. Now, we covered this thing about they're adjusting to this life from being gone for what, 2-5 years, or I had the impression when we had those two ladies on this show that they had trouble adjusting when they came back, and I wonder, do they just not get any help with that, or?
So I'm not a veteran myself, but what I've been told by the vets that I work with is that many vets, when they first get out of the service, and perhaps they are vets that have served overseas, sort of the last thing they might necessarily want to do is go to the VA and start to, work on some of these potentially problem issues, et cetera. A lot of times they'll say, all I wanted to do was I just wanted to get home. I just wanted to relax. I wanted to enjoy life some. I wanted to connect with my friends and family, et cetera. And I didn't want to have to report to the VA and dig in on this stuff. I figured I would be okay. This is what I've heard. And so by and large, I think that can generally contribute to a lot of veterans not necessarily getting enrolled at the VA when they first get out of the service. We've recognized this. And because of that, we have made a special effort to make sure that we try to get every single vet that discharges from the military enrolled at the VA. We know how important it is, certainly in terms of our efforts to bring the suicide rates down, and I believe we are going to do that with all of this collective work that we're doing. But also just in order to provide support for the vets, and it could be in terms of their medical health care, or in terms of helping them, figure out how to use their GI Bill or their VA loan, or to go to school, or to get help finding work, whatever it might be. We have a special program that is dedicated specifically to that end, to enrolling vets when they first discharge from the service, and to assign them case managers if they need one, to help make sure that they get all of that support right as soon as they get out of the military. Now, this is pretty new. This is within the last several years. I think the VA, from what I understand, I've been at the VA for about 12 years altogether now.
Oh.
And I have heard that before that, it was a different situation, that someone would have to kind of go to the VA and knock on the door to get in, and you could probably tell me more about that. But now, in the last several years, the VA has really changed tack and has done everything we possibly can to get out into the community, to emphasize to veterans that it's extremely important that once they're enrolled with us, they have access to all these various services. And that's a big part of my job as a suicide prevention coordinator, and my fellow social workers on our suicide prevention program team is we, as I'm here with you tonight, we are out in the community. We are doing everything we possibly can to send that message that we're here for you, that the access door is open, and that if you, in fact, do struggle with any difficulties and you enroll with the VA and you get mental health care, for example, if you need it, you are far less likely ever to perish from suicide, for example, and you're far more likely, to do better in every sense. So that outreach now, I think is, something that I'm really grateful that we have. That's a big part of the job that I get to do.
Well, let me ask you about that. I'm under the impression when these service people, male and female, get out. They just go home. Now, you're saying they reach out with email, or what do you think they do?
Yeah, we have post-deployment events where we physically send our social workers and we try to meet those folks basically right when they get off the plane. And we try to get them enrolled, and at least, if nothing else, give them all the information. So that if perhaps, once in a while a veteran may say, I'm not going to the VA, I've had enough, of Uncle Sam for now, and I just, whatever it might be, we at least make sure that they know that we're here for them. Yeah.
I can't imagine how important that is.
It is,
That, it's no longer are you going to go fight tomorrow. We want you to come and we'll help you. That's what you're saying.
And just having that door open for when they're ready to get help is a key element, because they're no longer in the military. No one can order them to get help, for example, anymore. And sometimes this will happen where I've had calls, say, from a family member that, will say, I'm really worried about, my husband or my brother or my father. And, I'll speak to them and I'll say, hey, your loved one is really worried about you. You're showing some signs of difficulty. Would you like to make a mental health appointment? I can connect you with our mental health triage nurse, and they can get you, a mental health appointment right away. And the vet might say, no, I'm going to be okay. They're worried about me, but, they worry too much, and I'm working hard and I'm doing my thing. And I'll just say, well, hang on to my phone number. This is also the appointment line number. Just keep this written down. And if you ever decide you want to try it, it's all voluntary now. If you come and you don't like it, you don't think it's helpful, you don't have to come back. Nobody can order you to do this anymore. But make sure you keep that card handy. Well, sometimes, Richard, I'll get a call 3 months later. The vet will say, I don't know if you remember me, but you told me to hang on to your number. Things have definitely gotten worse. Maybe she's saying, if you don't get help now, I'm going to divorce you or whatever, I got to come in and get some help. And I'll say, absolutely, we're here for you. I'm glad you hung on to my number. Let's get you an appointment. And in the case of our suicide prevention program, one of the key things that we do at the Department of Veterans Affairs is we do specific suicide prevention safety planning with our vets, where we help our vets draft their own suicide prevention safety plans. So it's not just, kind of an old school contracting for safety, promising they won't hurt themselves, which isn't actually very useful, but instead saying with the vet, if you are having a really difficult time and it's so bad that perhaps you could even start to go down that road of having self-destructive thoughts or feelings, what are the things that could possibly be helpful for you? And so we'll go through and we'll help the vet draw up the things that they can do to take care of themselves, to stay safe, to use positive distractions, the interactive things that they can do with other people, support groups, their spiritual practice, friends and family that are there for them, as well as all of the professional supports. So there's specific medical and mental health care providers, the crisis hotline, the hospital, the emergency room, and for our veterans, we have our Wise Warriors suicide prevention therapy groups, which are these very informal, very mutually supportive therapy groups for veterans that have ever struggled with any kind of suicidal thinking or have even survived suicide attempts and who have their safety plans. They can come once a week, drop in groups, and they can work with other veterans and have that mutual support and camaraderie from other veterans that get it, that have struggled with that suicidality, so that they can offer that support to each other to stay safe and to approach some of these problems as effectively as possible. And I started the first one here in Portland, over 9 years ago probably now, and we have been going strong. It started out as a 90-minute group. We had to make it a 2-hour group because so many veterans come, even just on a drop-in basis, and they find it so helpful. We now have them here in our area. We have them not only in Portland every week, but we also have them in Vancouver. We have them in Salem, Fairview, even over in Bend. And so to be able to have that specific support of the safety planning and also the ongoing drop-in supportive therapy groups for as long as the veteran would like to be involved with them is a key way for us to be able to specifically serve the vet and help them identify the things that can be particularly valuable for them in staying alive, staying safe, and getting better.
You know, I have to say, all this time, you've been talking about veterans, people will assume male, male and female. You hear from females,
Yeah.
right?
Yes, absolutely. And you're right. That's a common misperception, that vets are males. And I have friends of mine that are female veterans. I have colleagues of mine that are female veterans. And they will often say, someone will meet us and they'll think, oh, well, you must be the wife of a vet, and no, often the female veteran, is a veteran herself. And unfortunately, one of the sad realities is that the rate by which female veterans are being lost to suicide has actually been on the increase the last several years. And the rate by which female veterans are ending their own lives with firearms has been on the increase. And this is extremely important for us to know. Firearms are by far the most common way by which all Americans die of suicide, and certainly all veterans. That it's the most common means of self-destruction.
Yeah.
And so whenever we can strategize about helping keep the environment as safe as possible, if every vet I work with, I ask them, do you ever think of shooting yourself? I always ask them that. And if they say, well, yes, I do, then I say, what can we do about that? This is where our emotional reactivity is so impulsive that if we have that means of self-destruction right at our fingertips, that's a particularly dangerous situation. It's a particularly dangerous environment. So it's important to work on that issue, both with males and with females. We have our gun locks that we offer to anyone that would like to use them. And what they do, you open up the chamber, you run the cable through it, you can separate the key, and you can do whatever you want. You can have the keys stored separately or have somebody else store it for you, so that if you're ever in that moment of acute distress and that impulsivity is there, you are slowed down. You can't just grab that loaded gun right away. You have a little bit of time for that rational thinking to catch up to that emotional thinking. That's guaranteed, that's impulsive, and we have a little bit more time. I worked with one veteran, and I asked him that question. He said, yeah, I have thought about shooting myself. And I said, well, do you have anybody that you would trust to store your gun for you for a while, that we can have your gun for you while you're going through this chapter of therapy? And he said, Joe, I've been ambushed in the service. I've got to have the gun in the house. I'll never be able to sleep if I know I don't have my gun. And I said, I understand that. But I said, statistically, you're twice as likely to shoot yourself as you are with a gun, in the United States. What are we going to do about that? And he said, well, I'll use a gun lock, and I'll separate the key, and I'll put it in a Tupperware with your phone number and with the crisis hotline number, and I'll fill that with water, and I'll stick it in my freezer. And that way, when I'm having that really terrible time, I've got to get it out of there. I've got to chip through the ice. I've got to see your number, the hotline number. But by the time I do all that, he goes, it'll slow me down enough to remember to call. And we wrote that specifically into the veteran safety plan. This is what he was going to do. Well, that vet is still alive, and that vet is doing much better now. Because we strategized around that.
I thought it was great.
Yeah. Anything that we can do in terms of addressing the dangers of that impulsivity, whether it be regarding guns or overdose, which is the second most common means by which Americans perish from suicide.
Opioids?
You're right. Illicit drugs or prescription drugs, both. Overdose. Anything that we can do to work with the veteran in terms of safe medications and drugs management, either with their family members, with their prescriber, using locked medicine boxes, using the pill boxes that have the hotline number on them that we give out, working with the prescriber and saying, I've struggled with this, and I think that I just need to get more frequent refills. And so getting their medications maybe every week or two instead of every 2 or 3 months. So you don't have a whole ton of medications on hand at any given time. All of those are different strategies that are a part of our safety planning to, again, help diminish that risk of immediate impulsive self-destruction, just like with the guns. The third most common means by which Americans are dying of suicide right now is hanging. So I always ask every vet, if they ever think of shooting themselves, I ask them if they ever think of overdosing with anything. And a veteran who may have ideation regarding hanging, someone that might say, I know my grandfather hung himself, and I've always thought if I ever did it, that would be the way that I would do it. I say, what can we do about that? How about if we don't have you have any ropes or long cords or anything at home right now while you're going through this chapter of getting help, and we'll write that in their safety plan. I will ask my friend to, store my ropes and cords, and I won't have any at home for now, etc. So we specifically target that aspect of keeping that personal environment as safe as possible from the impulsive, self-destructive impulses, and that's a key part of our suicide prevention safety planning that vets have told me over the years is incredibly valuable. They've said that the safety plans, the gun locks, the pill boxes with the hotline number on them, the safe medications management, strategizing, all of that stuff has helped save their lives.
Oh, yeah. I love the ice. The ice trick.
Yeah, right?
I thought that was great.
Yeah. Oh, it's interesting. Folks can be very, very creative with this. And I am convinced that this work that we're doing is going to bring those rates down. They're going to come down.
That's what we want.
We do. And we've done it before. We've done it. We used to have much higher rates of automobile accident related deaths in the United States. And we said, well, what are we going to do about that? And we created seatbelt laws. We created car seat laws. We cracked down really hard on drunk driving. We created legislation that required the automakers to make the cars safer and put in more safety features in the cars. And sure enough, the death rates from automobile accidents has gone down in the United States. Now, unfortunately, while suicide rates have increased over the last several years, all of us, by just virtue of being Americans, we are more likely to die from suicide than we are from a car accident.
Oh.
That's a fact. But like I say, that is an example where we collectively approached this problem, and we did it. We did the same thing with smoking-related lung disease. We used to have a lot more folks that were dying of that, and we said, what will we do? Let's make it much harder for kids to get started on cigarettes.
Right.
Let's, ask our doctors what can they do to help us quit smoking. Let's form support groups to help each other stay off cigarettes. And sure enough, we've brought those death rates from smoking down in the United States. So I know that through this collective work, the day will come where we hear the news that the suicide rate is diminishing, both for veterans and for everyone. But it's going to take the same kind of collective effort that we used in those examples to bring it down again regarding suicidality, and we will do it.
I've had 3 people close to me that died from cancer, and I say, how'd they die? Smoking.
Yeah.
Well, that's the way.
Yeah.
It isn't just cancer. That's what did them in totally. But if they hadn't been smoking, there wouldn't have been a problem. So,
well, in the old days, everybody used to smoke, right? I used to smoke. Fortunately, I quit.
Oh, okay.
And we know, and we've promoted that education and that support, and we still do that at the VA. We have special smoking cessation therapy groups that if that's your issue, you can come in our mental health clinic, and we will help you quit smoking and stay off of cigarettes. So, as I say, that same approach that has worked, for lots of folks to prevent this from happening as much can be used in the case of suicidality, and we will.
Right. You see, Northwest Battle Buddies. You know what that is?
Yeah.
We've had him on the show, but that's been a while. Probably time for him to come back again. Yeah. But they train those dogs up there. And that when you mentioned a while back about somebody when they lost their dog or whatever, I wonder if that was, boy, because those dogs go through a lot to get to where they're helping. And there's always a waiting list, but it's hard for those people doing it because they're all doing it free, just working at it.
Yeah, that's actually one of the things I have found, that for many veterans, if there's any sort of magic tricks in this business, one of the things that is the most helpful is the service animals, the service dogs. I not only think that specifically in the case of those trained service dogs, that they perform an incredibly valuable service in helping people stay safe and get better, but animals in general. I ask every vet when we do their safety plans, I ask them, do you have any animals? Do you like animals? Do you enjoy animals? What do you do with your animal? And sometimes I'll be working with the vet and they'll say, oh, nothing helps me anymore. I'm so depressed. Things have gotten so bad, just nothing works anymore. And I'll nod and I'll say, well, do you have any animals? Oh, yes. Boy, if it wasn't for my, my dog Summer, I would be gone a long time ago. And then I say, oh, well, tell me about your dog Summer. What do you guys like to do? Oh, she, loves to go to the dog park with me, and she loves to pick catch. And sure enough, it turns out there are a few things. The vet was maybe so distressed at the moment. He wasn't remembering, how important it is that he gets to do these things with his animal. So I will then put in the safety plan, spending time with my dog Summer, going to the dog park with my dog Summer, visiting with the other dog owners to the dog park, etc. So yeah, animals, and particularly trained service animals, are very, very valuable. They're up there, I would say, with a few other things that are incredibly important if folks can identify them as being helpful. Another one is just any physical activity, anything that a person can do in terms of exercise, just even walking, exercising, prioritizing trying to eat healthy food.
Biking and swimming.
Yes, exactly. Anything we can do to get enough sleep, get enough water, get enough nutrition, and get enough exercise to help our bodies feel better will help our minds and our hearts feel better. So I ask every veteran about that. I ask every veteran about their spiritual practice, if they have anything that they do in terms of spiritual practice that is helpful for them, and if they have any congregation members that they can connect to, or clerics that could be helpful for them, people that do, that's often a source of great strength and support. I ask every veteran about volunteer service, because these are folks that served in the military, so they're already oriented towards being of service. Volunteer. Right, and so I say, do you do any volunteering, or would you like to do any volunteering? Because volunteer service is one of those ways in which they continue to get to be of service to others after they're out of the military. And again, one of those close to magic tricks in this, it's a win-win situation. If somebody appreciates volunteering, it makes us feel good that we're helping someone else, but we feel good for doing it. So I always ask vets each about all those key points when we're doing their safety plans. And if they say, no, I haven't, but that sounds like a good idea, I'd like to volunteer, I'll ask them, well, what sorts of volunteer service would you like to do? Would you like to work with other veterans? Would you like to work with older folks? Would you like to work with younger folks? Would you like to work with animals? And we'll work on it. I'll help them look it up, and I'll say, hey, here's an organization that's looking for volunteers. Let's call them and put that in your safety plan. And then we'll follow up, and like I say, they can come to our ongoing supportive Wise Warriors groups, and we'll say, hey, how did that go when you contacted, the animal shelter, or, the Veterans Hospital, and you thought about, you asked about volunteering, how is that going? And so we can provide that ongoing support. And that's how folks get on track. They get on track to stay safe and to get better. And that's most of my job. Most of my job every day is having folks say, thank you, this is helpful. It's hard, but it does feel better, and I'm going to keep at this. So I know that this work that we do does help people. It does make a difference. Sometimes you'll hear people say things like, oh, if somebody really wants to kill themselves, there's nothing you can do to stop them, so why should we bother? In reality, that's not the way it works. It's not the way it works, that we actually really can help each other. And that when we do, as I mentioned with folks that are just engaged in mental health care, period, or engaged at the VA period, we have a much lower risk of ever dying from suicide.
Okay, no. I think you're really doing great. Where do you get, or where would someone else get their training to be like you? Do they go to a certain, go to university, or what? I just have no idea.
Yeah. So I'm a clinical social worker. Okay. So I have a master's in clinical social work. Okay. So I went to the Portland State University School of Social Work. And
here in town.
Yes, yeah, it's a graduate school program at PSU that's been around for many years, and actually a number of my colleagues came from there. But if you wanted to go this route of being a clinical social worker, such as myself and all of the folks that happen to be on our program team, being suicide prevention coordinators in our catchment area, we're all clinical social workers. So you get that MSW, that Masters of Social Work, and then ultimately you'll go through a couple years of internship during graduate school. Then you'll go through a couple more years of supervision with a previously licensed clinical social worker, which I completed all of that work when I was at the VA. That's how I got started at the VA, was as an intern back in graduate school. And then I loved working with veterans. I loved working at the VA. So I applied to work there after I finished graduate school. I was fortunate enough to be able to get hired. I did my clinical supervision there and then tested for my state licensure, which is what we all will do in this case. And then once you're licensed by the state, you're a licensed clinical social worker. And that's a lot of the mental health care that is provided at the VA is by social workers. There are certainly, of course, all sorts of other mental health clinicians that provide care. There's our psychiatrists and psychiatric nurse practitioners, our psychologists, licensed professional counselors, et cetera. But a lot of us are clinical social
Well, you were
workers.
totally logical to get to do that.
Oh, thanks. I don't know about that. But yeah,
training and everything.
I realized, that I really wanted to do this work. And when I started graduate school, I wasn't specifically sure where I wanted to work after graduate school, but then I was fortunate enough to have my second internship in grad school at the VA, and that's when I knew I loved working with vets and loved working at the VA. I personally think that the Portland VA is an excellent VA. The outpatient mental health care program and the inpatient mental health care program, I just can't say enough about the good people that work there. I have terrific support from my colleagues there, and I know there's a lot of folks there who are trying very hard to do good work and to help people. I feel very blessed to be able to be there.
Right. There are other places for veterans to call, other numbers. I'm not sure where all they are, but I'll confess that when I called, it was a local number, a 503 to get. And the first time I called, they didn't have anybody available. So I remember it got so bad, the lady said, "Are you thinking of killing yourself?" In other words, she was.
They made sure you were okay.
Say, well, if I can't get someone to come on my show, maybe I will. Well, I'm just kidding, of course.
Yeah.
But, I was lucky to come back the second time and get you to do this. So now there is just so much time left, and I want to make sure that we've covered everything. If there's still some veterans out there, some more ideas as to what to do to call. Well, you'll find this number. The computer?
Sure.
Computer,
Yeah. If you just Google Veterans Crisis Hotline, it'll come right up. We have it posted on all of our online media. So if somebody just goes to the Portland VA website, for example, any VA website in the United States, you'll see it. It's a very easy to access number. There are folks that are specifically tasked, as I mentioned, our mental health triage nurses, with helping make sure that vets who need mental health care can get an appointment as soon as possible. Any veteran, if they're already enrolled with the VA, first you want to start by getting enrolled, which is extremely easy. They've got it streamlined. You, for example, show up at the enrollment office with your ID and your discharge papers. They're going to have you're going to walk out of there enrolled like within half an hour.
All
They've got it really streamlined. But if you need mental health care, any vet can call and say that they would like to speak with the mental health triage nurse and that they need a mental health appointment. And then the mental health triage nurse will say, they'll ask them a few basic questions about what's going on, and then they'll ask them, when and where is the best place to schedule that initial health care or that mental health care appointment, and they'll get that scheduled. So it's really important that vets know that. There are, as you mentioned, other organizations in the community, some of whom with which we partner. There's the Returning Veterans Project, which is another excellent resource. And that's a specific program that cultivates relationships with various care providers in the community that volunteer to provide services, not only for vets that have served overseas post 9/11, but also with their family members. And so if a person may need individual therapy, they may need family counseling, but there's massage therapists and acupuncturists, and there are equine therapists. There are folks who will provide horse riding therapy. Okay. Yeah, there's any care provider that would like to help serve vets and their families can volunteer with the Returning Veterans Project, and you can look them up online to returningveteransproject.org, and that way if a vet would like to have that additional support, They absolutely can. Or if someone who would like to help vets and take a portion of your time to be able to serve vets and their family members, they can volunteer with that. We also have, within the VA system, our standalone vet centers, which are counseling centers, mostly based on the peer-to-peer counseling model, to where many, if not most of our vets at the vet centers are veterans themselves. And we don't have our medications prescribers located at the vet centers. If you are working with a medication prescriber, you can work with, say, your psychiatrist at the VA. And then if you would like additional counseling for military-related PTSD, you can also go to the vet center. And the vet centers provide both individual and group therapy for veterans that have struggled with either combat trauma PTSD or military sexual trauma
something
PTSD.
we didn't cover that much.
Yeah.
I was just seeing one of the D-Day programs, and it talked about how somebody talked about how bad they felt, and the veteran consultant back in that day said, "You just have to get through it."
Right.
But they had the public behind them. The entire country was behind the veterans then, and it does make a difference back then. Of course, that's when everybody was working to win the war at the same time also. So anyway.
Yeah, we have both inpatient and outpatient PTSD treatment programs. The vet centers I just mentioned are a big part of our outpatient treatment program. Any vet that has struggled with PTSD in any form from either combat or military sexual trauma can access the vet center. You can actually refer yourself to the vet center. You can just Google Vet Center, and you'll see that here in Oregon we have them in Portland, we have them in Salem, Eugene, Grants Pass, and Bend. I think I'm remembering all of them. And you can refer yourself to them. You don't need to go through anybody else. You can just call them and say, "Hey, I'm a vet and I've gone through some difficult stuff. I think I might need to get some help." And they'll schedule you to come in and meet with a counselor there. And then we also have inpatient PTSD treatment, again, for both combat and military sexual trauma. We have inpatient treatment for veterans throughout the United States in different centers. We have them here in the Northwest, in White City, in Oregon. We have them at American Lake in Washington State, and at Walla Walla. And for example, and if a person needs to find out about inpatient PTSD treatment, folks can inquire with the VA about that as well. We can talk about how that works, and folks can be referred for that.
And
so we do emphasize that treatment.
To the library, if you can't find phone number any other way.
Absolutely.
Libraries have access.
That's right.
So.
You can also call 211, which is the social services information line.
Okay.
Yeah, it's like 911, but you call 211, and you just say, "Hey, I would like to find out some information about services for veterans," and they'll look it up for you right away.
Well, I'm Richard Carpenter. I guess I never mentioned that, and I want to thank my guest, Joe Bertagnolli.
Yeah.
Okay, who is a suicide prevention counselor, clinical social workers, right up on the hill, the veterans, right up here in Portland. And I want to thank the crew without which we couldn't do this show. So I really appreciate having all this help. So thank you again, and this has been, frankly, a great show and very informative. Very informative.
Thank you very much for having me, Richard. It's been a real pleasure meeting you and being able
I got you this time.
to be here. Absolutely. I'll be happy to come back anytime.
Oh, yeah. Okay.
Yeah, my pleasure.
Right.
Thank you very much.
No, thank you.